Friends. I hope you are doing well, and I hope you're taking good care of yourself. I wanted to check in with you because there is a lot going on, right? There's been a lot going on for the past few years, and there's been a lot of focus on how we can support our physical health, even how we can modulate or manage stress, and those are important topics. What I've been really focusing on, if you've been a follower of me, is how to really gain resiliency by balancing our emotional and our mental health, right? We are in a crisis right now with more and more people being diagnosed with psychiatric illnesses such as anxiety or depression, and a lack of ability to access this treatment and a lack of wanting to, related to some of the stigma associated with it. And this was before the past few years, and it continues to increase. And it really, when everything kind of hit, it increased a lot. People were feeling more anxiety and a lot of low mood. And this is because chronic stress and overwhelm can actually rewire the brain to actually lead to a mental health problem later on. And we know that sometimes people confuse stress with anxiety. There's actually different brain patterns in someone that has a psychiatric diagnosis versus someone who doesn't. So stress is something that happens to the brain when it's on overwhelm from a situation. And once the situation is cleared, you get back to your set point. That doesn't happen with someone with anxiety. There's always this kind of overactivity going on in the brain, right? Kind of this inability to relax the mind and the body. So what I wanted to talk about, and I did this in the past few articles, and I really brought it home in this current article, and I really love your opinion on what you think when you read it, is the combining of traditional, or conventional is probably a better word for it, psychiatric treatment options with naturopathic and integrative and holistic modalities. Now, I argue and really feel strongly that it's best to combine them both, right? So as a naturopathic doctor in New York, I always have someone that I can refer to because I can't diagnose, treat, or prescribe in New York. But I do know some great therapists, and I knew some great psychiatrists. And specifically, cognitive behavioral therapy, I think, is very helpful for people with anxiety issues, and I think for people, especially with OCD, which is chronically not treated effectively and misdiagnosed for years. The cool thing with cognitive behavioral therapy is you're actually intervening at the level of the mind, at the level of the cognitive bias, and you're actually helping to change the way that the brain functions. There's actually been studies that actually show the neurobiological changes that occur related to cognitive behavioral therapy. You can literally train how your brain is wired to process certain environmental cues, which is pretty cool. And add that on top of some of these naturopathic and nutritional and lifestyle interventions which affect brain health, which have been shown to be correlated to specific mood states, including depression and anxiety. For example, fish oil, right, has been shown to be connected to depression as well as to different mood states. The amino acid NAC is actually been linked to helping with some of the brain patterning issues with OCD, obsessive compulsive disorder. Essential oils, right? They modulate our biochemistry, our neurological signaling, our brain patterning, our physiology. They do MRI studies with certain essential oils, and we see changes on brain imaging. So the two of them combined can be amazing. And I just wanted to bring this to people's attention because what's going on right now is traumatic, and I don't want to undermine people that are promoting positive mindset, and even I've promoted positive mindset in cognitive reframing. I think that's important. But if we're at a state where we're needing more support because there could be some anxiety or depression going on, I think it's important to reach out and not choose one or the other, and definitely get the standard of care treatment, first, because that's the standard of care. And you want to I think, combine them, because if you simply use natural therapies to feel better, you might not be addressing the underlying cognitive issues that are perpetuating the symptoms. And if you're not addressing the brain health factors, such as nutrients, lifestyle factors, sleep, right, oxidative stress, hormones, genetic variations, and how the body processes certain nutrients, then you might not actually be able to get as effective cognitive restructuring, because your brain doesn't have all the nutrients and all of the raw materials to make these neurotransmitters and to make these shifts. Okay, so that's what I wanted to bring your attention to today, and I'm actually working on a couple more articles that are going to talk about this whole aspect of how somebody manages and copes with trauma, what are the 3 different responses, how hope is coming and how that affects our mental and emotional health. So I got a bunch of material on its way, and I can't wait to share it with you. And in the meantime, I hope that you're taking good care of yourself. Love to hear your comments. Please get the support if you need it. And know that mental health is brain health. You can hashtag that. And know that you can also support brain health with some of these nutrients and integrative therapies, as well as you're using some of these conventional therapies. And I did write an article on how naturopathic medicine could be really supportive as a bridge between the availability of what's out there in conventional treatment options and efficacy on getting better results and more access to people. Okay? So with that, I will leave you, and I hope that you have a wonderful either rest of your day or the rest of your evening. Take good care.